Got it. Now, let's talk about some companies, smaller companies. Let's say my company, I have 30 employees and about 6 or 7 of them are out of my office, okay? And out of the state by pure accident. But, or anybody else, a restaurant guy, or maybe it's a restaurant guy with a chain of restaurants. Why, besides of making sure that his people are not going insane because they're high, what other reasons are there for a guy like me to have his people tested on drugs?
It's beneficial to any employer to have their people tested on drugs. We live in a civilization and a culture in which there are a lot of users. And for an employer to be able to say, I randomly test my employees for the purpose to make sure that the services that I render to other employers are done by people that are not under the influence of alcohol or drugs. Also, sometimes the workers' comp insurance that you have may require that. Sometimes they will even give you a reduced rate if you randomly test your employees. It is a beneficial thing.
I see. So do people, since you mentioned that, do people, individual people, or anyway, health insurance, are you aware of that some health insurance companies give a break if a person is provenly off drugs? And prove that by drug testing, obviously? Or not?
In terms of general medical insurance, I don't know of any companies that address the issue of drugs. They certainly address the issue of alcohol and smoking, but I don't know that they address drugs other than at the time that you get the health insurance. Some health insurance companies are now requiring an examination as an initiation procedure for health insurance.
Well, if that's happening already, then I can almost guarantee you that given out a few years, that will become more prevalent, because especially health insurances currently are looking at everything to raise the fee rather than, of course, they say we lower it for the people who are good, but the reason they're doing it is so they raise it for the people who are bad. But that's beside the point. That's a whole different topic. The point is, call it discrimination, call it whatever people might want to call it, the ones who fight it. The fact is, it is true. If you're a heavy, overweight person and eat bad foods and all that stuff, your risk is higher, and just like, so it will come.